Hey everybody,
Hi,
welcome back to the RightHab channel. As always, I am Dr. Roy,
and I am Dr. Marco.
and today we're here to talk to you about an article, a review that Marco was reading.
Yeah, so this is just a really brief overview because there are clinical practice guidelines for ankle injuries. And if anybody has read this type of articles, they're reviewing a lot of information, a lot of articles, a long history of information. So they tried their best to summarize it. So in this review, what we will be talking about in the future would be the difference between a recent injury, like an acute injury, and what they call chronic instability. So we're not too thrilled with the terminology, but we understand what they mean. It's just recurring ankle sprains.
Right, instability gets used a little too much in our opinion.
Yeah, so they do talk about different things like what classifies them, who's more at risk, what type of sports, and so we'll talk a little bit about that, and
Yeah,
then and they do talk about treatment options for both scenarios. So
and in particular, earlier you and I were talking about the treatment that they recommended.
yeah, so they recommend all sorts of treatments. It'll make more sense once we do a full review of it
Yeah,
with you guys, but there is manual therapy was recommended.
good for us. We like that.
Yeah.
Now
Um,
these are for ankle sprains.
Yeah, ankle sprains. This is very particular to that. When it would be appropriate or not appropriate to do dry needling.
Yeah,
No shocker. Ultrasounds was not recommended.
yeah. And balance was.
Yeah, balance was. And I think the big takeaways that we want to spend a little more time is indoor or not indoor, just any type of court sport. So volleyball,
Tennis.
basketball, tennis, like that
Yeah.
sort of thing. There's some interesting findings in that, and so we'll talk about
And some
that.
interesting recommendations that go against a lot of what some people say.
Yeah, very
But with a
interesting.
caveat that makes it a lot more tolerable, if you ask me.
Yeah, absolutely. So I think this is an exciting topic because we do, a lot of clinicians coming out of grad school don't really have a good understanding on how to treat ankles, especially ankle sprains.
Yeah,
And so we're kind of excited about
I
this
think it's
one.
basic and boring and
Yeah.
not functional. Real
Yeah.
quick.
So a lot of info. We're gonna break it down into segments. That way, it's a little bit easier to digest.
And if you're following us, thanks. If you haven't, go check out our podcast on ankle four-way and why that's on our no-fly list.
Yep.
And that is something that we will discuss briefly, at least, when we do our full review of this article, which should be coming soon.
Yep. Thank you guys.
Everybody,
Bye.
thank you.